are going to look at what is clinical informatics, what is electronic health record system, that is a big part of this field, what are terminologies and clinical decision support systems, what is the role of AI in clinical informatics, where is India in this field of clinical informatics, how would you get started, and what does the future hold for this domain in clinical informatics. It's one of the hearts of clinical informatics, and it helps ensure semantic interoperability. That means data is not just shared, the meaning is preserved, and we can be able to act on the data. Now that we have talked about how systems can finally speak to one another using interoperability and standardized data, the next question is, what do you do with all this high quality data? So that is where something called clinical decision support tools, or you can refer to as CDSS. That's where the CDSS comes into play. You can think of it like a smart tool that sits on top of electronic health record systems, and they help doctors and nurses make better decisions. And an important note to everyone is that they don't replace a doctor's judgment, or they don't replace a doctor. It's just to offer an support for any useful insights that can be going around. For example, a CDSS might notice something on your lab test, like a low potassium level, and it can notify the doctor, oh, there's a low potassium level, maybe you should be careful of this, and suggest a replacement of medication or any diet and so on. So it's just, or it can be as easy as reminders for a flu shot or something like that. It's just having a smart assistant who's constantly scanning the patient data and offering insights. And there are two types of CDSs. There's rule-based CDSs and AI-based CDSs. So rule-based CDSs it's like an if-else kind of logic. So if the blood pressure is high, suggest a medication change, and so on. So purely very simple rule-based system. And then you have these AI-based systems that are more advanced. So they learn from huge amount of data that's there in the backend. They spot the patterns in the data, and they help predict before the event actually happens. Like, for example, sepsis is one of the concerns in ICU, cause of mortality in many places across the globe. So it helps predict sepsis way before it happens, because once it happens, you have very short amount of time to act on it. So by predicting it way before, it's giving the patients and the doctor a lot of time to act on it. So there is one, though this is great, like it reminds you and helps you with all the decision making, there's one downside that we see regularly is it's like a black box, right? You know it's giving you some suggestion, but you don't know how it's doing it. The transparency is less, so it's more like a black box. And sometimes people find it hard to trust. They're like, why should I trust a machine instead of just using my judgment? And there are times when the doctor might see many pop-ups and they can be annoyed, and this is called alert fatigue. And these systems sometimes don't have the entire context, right? The context for them is what you put in. So sometimes they lack context, they lack clean data to even understand everything properly. And sometimes clinicians, as I said, don't like it. But if used right, clinical decision support tools can be extremely powerful, and they make healthcare very safer and faster, especially more personalized. And some of them you must have seen in your daily life as well, like the drug-drug interactions. You have these systems that automatically show you the interaction when two drugs that are prescribed have something going on. You don't have to do it manually anymore. And sometimes it's just simple as, when your lab tests are abnormal, it flags that something is abnormal in your blood test. That's another rule-based, very simple if-else statement, and things like that. So it can also bring to the bedside evidence-based care. You don't have to do it yourself. The CDSS can help you bring that directly to your bedside. So that's why it's extremely powerful. In United States, as I said, electronic health system is a mandatory thing in hospitals. Clinical decision support tool is also a part of it. Doctors have been trained from the time they study to the practice with these systems. So you can see this being a part of their daily life very frequently. And then with AI, new systems come in every day, and sometimes that can be annoying to the users. All right, so we have talked about how decision support tools help doctors by helping them make smart suggestions in real time. But we have another important question, that is, where does all this data come from? Like, how do even these computers understand to give these suggestions, right? So to answer that, we have to look into the backside of an electronic health record. And that's the world of databases and data engineering. So we are going to look briefly at this, not into details because it's an extremely huge topic. But health data isn't just one huge file, right? You have all this patient details. It's not a Word document. It's not just one file, but it's different. It's organized in databases in different layers. The first one is structured data, which is nicely organized. You have different tables, like for labs, for medications, or vitals, and so on. So just to give you a visual, like imaginative memory, it's kind of like Excel sheets, but in tables, in databases, where you can query and find your things. And the second layer of this is like unstructured data. This is more messier. It's all your, like, you can just write what you think, right? How did you arrive at a particular diagnosis? Why did you give this particular medication? It's everything about the discharge summary that a patient should be aware of. So everything, it doesn't have a structure. It's just all in free text. And this is much harder for a computer to process compared to structured data, because it's having more structure. If you tell a date, it's only date. If you tell diagnosis, it only has the diagnosis in structured data. And then the third layer is metadata. Now, metadata means it's information about the data that you entered. For example, a doctor entered something into the system. What time did the doctor enter? That time is the metadata. What place did he enter? That's the metadata. So it's information about the data. Now, behind the scenes, as I said, these EHRs are connected by databases, and sometimes it's multiple databases. It's a warehouse of it. So you have all these tables for patients and visits, and they can all be connected together by unique IDs. Unique ID, maybe for a patient or for a visit. And that's how all these systems come together. And in our current modern healthcare, we use cloud so that it can scale on more national or enterprise level. And another note that we have to add is if the data is messy or if it's incomplete, these clinical decision support tools might give you wrong alerts. These AI models that help you make bad predictions. Researchers won't be able to find what they want. So it's extremely important to have clean data which is correct and usable. And for that, you have another process called ETL. ETL stands for extract, transform, and load. So extraction means first digital development in India. But one of the things that we have seen that it's lagging behind is in healthcare in terms of how it's still done on paper, PDFs, still not as much digitized as we would want. So one of the reasons is like, even if many hospitals use systems, electronic health record systems, it's still a very basic version how they manage this documentation. Some private hospitals use electronic health records, but even though they lack standardization. That means they are not mapped into SNOMED or ICD-10. Then once that doesn't happen, again, you cannot share the data between different hospitals. It's just useful for that one hospital. That's again another barrier. And then another barrier is we lack trained clinical informatics professionals in India, because doctor may not know how to structure the data, and engineers may not know how this healthcare clinical workflow works. So you need someone to bridge that gap, and that skill is coming from clinical informatics professionals. But that said, India is moving really fast right now in terms of digital health. You have this Ayushman Bharat digital mission, which is creating these health IDs, which is like a federated architecture, data architecture and framework for more consent-based data exchange, which is extremely helpful. And there are several startups like HealthLinks, EcaCare, Tricog, MedCords, and so on, which are making EHRs and AI tools, even for low resource settings. And then you have public health tools like Arogya Setu, which proved India can scale on digital solutions across hundreds and millions. And then some AI pilots are happening in ICUs, in radiology units, cardiology units, and they are tested in private chains. So you have the momentum. Here in India, it's just scattered and it's early, but it's going to get there in few years. And one more interesting challenge in India is you have so many different local languages. So maybe English alone may not be enough in an EHR to increase its adoption. And then not all places have Wi-Fi. And then if you have to put everything into EHR, you have to have a good speed at typing and documenting all this. So that's another thing that we need. And then sometimes private hospitals may refuse to share the data because they may say that we invested in EHRs, we want to keep it for us, we're not going to share. So what I'm trying to get to is we cannot take a solution from US or UK and try to apply it in India. We want Indian solutions for the realities of India and the problems that we have there. So the good news that we can think about is if we go back to the past and see India has leapfrogged in things like UPI, mobile phones, right? We didn't have to spend a massive amount of time to get to that place. So we have the highest population, so you have massive health data. You have a lot of young professionals, so you have a lot of workforce who's available, and you have a government that is now building on digital rails. So it's not far where clinical informatics can really come and shine even in India. All we need is people like you who want to learn and engage, be it a medical student, engineer, researcher, policymaker, anyone from any space and who knows about healthcare and IT, or either one of them, they all can contribute to clinical informatics. So if you are inspired from this field and you want to get started, what can you do as a first step to get your foot in the door, right? So we talked about EHRs. If you go to their website, they all are open source. They have communities that you can ask questions. They have guides. So please feel free to try it in any of the smaller clinics that you want to try it and see how it works out. See what are the gaps. Maybe you can be that entrepreneur which bridges the gap in the EHR field. And then from country to country, the problems are a little different.
Thank you, ma'am. One more question, ma'am. Which institutions would offer clinical informatic course online, which are also certified by central government?
Oh, I have to look that up in India. I am not sure of that answer yet. I can get back to that maybe on an email. Please feel free to just email me if that's an easier with this question, and I can get back to you on the email.
Yes, ma'am. Thank you, ma'am. What are the opportunities on IT side for family students? Languages, courses to learn for students who want to go abroad?
If you're having a plan of pursuing masters abroad, then a basic foundational course, just how do you write a SQL query? How do you write a Python code? Basics would be enough. When you're joining health informatics, they usually don't expect you to have the background in programming. That's the idea. They teach you during your master's program. So if you're coming for master's, you can apply as it is with your family, and then as long as you have a good score, you should be able to get into one of the universities here. If you are trying to get a job directly in a market abroad, you probably have to do some more advanced courses. Try to build GitHub repos with your own projects. Like the employer has to see what did you already do. And if they have to see that when you're a new graduate, you have to do a couple projects, at least the idea, right? You may not have a completed code, a working code. If you have that, great. But if you do not have that, you should have a project concept proposal where you're trying to find a problem in the healthcare and how you solved it. That kind of projects can help you easily get an opportunity to interview.